Hello Minister Lay, my name is Glenn Floyd and I have been involved as an observer and reporter to the United Nations and have had them involved in mental health cases whereby Australia is frequently and regularly violating the CRPD, Convention on the Rights of Persons with Disabilities, whereby these violations infringe international and human rights laws, as you well know. And I bring to your attention that you're now putting out your 5th mental health plan for a discussion from the public, which is part of this response by myself for Q&A. And I say to you, it's an indictment upon the psychiatric burden which has caused a $60 billion burden upon the community of death, morbidity and financial cost. In Victoria alone, there are 7,500 forced psychiatric community orders issued, forcing people into psychiatry. These people do not have, in the main, mental disorders. They are suffering very severe emotional distress and they should be treated not with psychotropic drugs which cause massive, not side effects, but direct lethal effects. They cause death, morbidity, violence, suicide, as you well know, as you put in your report, and you lament over that. Minister Lay, the system you preside over is causing this. We now have pandemic plague levels of death and morbidity that exceed cancer, heart disease, road deaths, heroin, cocaine and ice addictions. This is horrific. There's no other branch of medicine whereby $60 billion per annum is thrown at a pandemic plague and things get worse. The horrific thing about these forced orders is, Minister Lay, as you well know, that a person cannot put up their hand and plead to be detoxed from these toxic poisons they know are killing them. Psychiatrists merely declare they must take these psychotropic toxic drugs for life. You well know there is no test anywhere on earth that demonstrates that anyone has a chemical imbalance, the alleged reason for these psychotropic drugs to be issued. There is no test anywhere on earth that demonstrates a person has schizophrenia or bipolar. These are merely people who are suffering massive and overpowering emotional distress, and they are falsely and fraudulently labelled with mental disorders. You well know this. They need care, love, support and attention, and they need psychiatrists to be kept away from them. If any pandemic plague of, say, cancer, measles or polio, and this amount of money, $60 billion, were thrown at these pandemics, there would be results, there would be cures. But what's happening in the horrific system that you preside over, Minister Lay, is things are getting drastically worse and have done for the past 20 years. Something major is wrong, and it is psychotropic drugs and fraudulent, incorrectly diagnosed distress by people who do not have mental disorders. I ask you, as a Q&A question, will you immediately report on the absolute numbers of deaths, violence, suicide and morbidity where people are taking lethal psychotropic drugs that cause these pandemic deaths? And will you please report on the numbers of persons dying and suffering this tragic level of morbidity whereby people are under psychiatric care? Would you also please report on the numbers of coroner's reports that demonstrate these deaths, and in some cases murders caused by violence-inducing psychotropic drugs, were by people who are under psychotropic drugs? This information is actually concealed by coroners and concealed by government. Minister Ley, you're presiding over a death and morbidity rate which is at pandemic levels that exceeds anything in human history. I ask you to report on these matters. Thank you.